We're gonna start in 2 minutes.
You wanted to just come in?
The chair just stepped out for 1 second. Well, I guess we'll start. Okay, wonderful. Well, good afternoon, everyone. It is August 21st, 2024, and the time is 4:07 p.m. As a quorum of the committee is in attendance, I would like to call to order the meeting of the Central Health Budget and Finance Committee. As a reminder, some of our committee members may be also participating by video conference, and I believe Dr. Brinson, I saw her. Is she still on? Will be participating via video conference, so the staff will be managing video and audio feeds of all participants closely to make sure we have a legally compliant meeting at all times. I would like to also announce that in order to make it more accessible for community members, we will hold public communication for the Budget and Finance Committee, Executive Committee, and the Board of Manager meetings at a certain time of 5:30 p.m. Unless someone would like to speak now related to the Budget and Finance Committee, I will, if there's anyone that would like to speak on this commit, on this behalf. We do have one. So, can we? Do you have the language? Do I have to read out the rules?
I
So-
have the language. I can read the guidelines. This
Oh,
is
thank you. I
Yesenia.
really appreciate it. Appreciate it. Thank you. Go ahead, Yesenia.
Yes, I will now read the guidelines for this meeting's public communication. When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number after your introduction. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. We received one submission for this evening's public communication. At this time, I will call on our speaker, Ms. Mia Greer.
Welcome.
Thank you. I think that's the right one. Is that the right one? Okay. My name is Mia Greer, and I represent Central Health, and I represent Community Coalition for Health, and I also represent the African American population of Travis County into Hayes County into Bastrop County, so I represent quite a few. But here in Travis County, one of the things that I want to make sure that the board is aware of is that we understand that we have to reach out to many, many, many different populations. That is very clear. But I want to make sure that the board really remembers that African Americans are, when it comes to mortality, when it comes to morbidity, we still are number one in Travis County. And Central Health, as much as I enjoy being a part of Central Health, we are just now scratching the surface when it comes to African Americans. And I want to make sure that when you are doing your budget, when you're looking at your budget, that you also include the other communities, but not disclude the fact that African Americans are high when it comes to their health care. And we also, we love the Black Men's Health Clinic. We love it. But our studies of 700 African American men in Travis County showed that it takes women in their lives, 96.4% of my guys in here, 96.4%, I believe, listen to their female counterparts before they even make a medical decision. We found that out with 700 plus African American men. So I want to make sure, yes, the Black Men's Health Clinic, wonderful, wonderful thing. But you can't remember the mothers, you can't remember the sisters, you can't forget the aunts, the wives, and you can't forget people's partners. And that is one thing when it comes to African Americans, that is a cultural thing, that you got to reach us all before you get one of us. And I think Community Coalition for Health is doing a great job of that. They come to us like we literally clock in and clock out at Central Health. Also, I want to make sure that when you are thinking of your budget, that you don't forget that Community Coalition for Health has been doing this for Central Health for so long that they associate us with you. So it's almost like we are now melded together as partners. And so people see, I had a person who I tried to get to come tonight to tell his issue about trying to get MAP, and someone calling him and telling him to go to Medicare. And so I said, will you come with me? He was like, I got to go to work. The other thing about African Americans that I need you to know culturally, and I think I've told you this before, I had to ask my pastor if I can come here because Wednesday nights we're preparing for church. We're preparing for church. We're not thinking about a meeting. We're trying to get off work as fast as we can, get something to eat, and get to service. And that's another cultural thing that we have to remember. If you want more of us in these meetings, that you'll have to decide that we may not can do it at your convenience, but maybe at the convenience of the people that we represent.
30 seconds.
The other thing, thank you so much, is that I know that I haven't heard a lot about the equity.
Recording in progress.
The equity program. I haven't heard a finality of it. We've talked about it, but I never see anything that's final when it comes to the Equity Action Program. I haven't seen it. If I have, if it's out there, I haven't gotten it. Thank you so much for your time. I appreciate it. I had back surgery, so I'm going to skedaddle out, but I'll be listening. Thank you so much.
Thank you so much. I really appreciate your voice, and we just want to let you know we hear you and we see you. Thank you. Now, proceeding, members, we'll proceed with our Budget and Finance Committee agenda. As long as we don't have any other speakers, does that end our public comment for this
Yes.
committee? Okay,
Yes,
thank
this
you.
concludes public communication.
Thank you so much. So proceeding to our committee agenda item 1, approve the minutes of the August 7th Budget and Finance Committee meeting.
I move approval.
Thank you. I have a first by Manager Motwani and a second by Manager Valadez. All in favor? Aye. Thank you. And proceeding to agenda item 2, receive and discuss a presentation on the proposed Central Health fiscal year 2025 tax rate and budget. Jeff Knodel and John Morgan will be presenting. As they're proceeding to the podium, I would like to share a few words with you all. Dear board members, staff, and community, after months of listening, engaging with stakeholders, and deeply analyzing the challenges faced by underserved communities in Travis County, we have arrived at an important moment, voting on one of our largest budgets to date. This budget is not just a financial plan, it's a commitment to whole person care, grounded in the belief that health is a fundamental human right. We believe that every person, regardless of their race or background, deserves equitable and compassionate care. We are tasked with providing care to everyone who needs it, and this budget reflects our unwavering dedication to that mission. I'm particularly proud that we are expanding healthcare services, including specialty care like cardiology and nephrology, areas where our patients previously faced long waits that exacerbated their health disparities and led to poor health outcomes. We are also broadening our behavioral health services, enhancing care for the homeless, offering respite care for those needing peaceful recovery, and expanding our jail health services. Central Health is playing a critical role in creating new service lines to fill gaps that are currently missing in our community. These service lines are not just additions, but essential components that address severe shortages in care. By innovating and expanding our offerings, we are directly responding to the needs of our community, ensuring that no one is left without the care they deserve. We must also acknowledge the challenges and tough decisions that came with crafting this budget. Balancing immediate needs and long-term sustainability was no easy task, but it was necessary to ensure that Central Health can continue to serve this community effectively for years to come. As an organization, Central Health has grown significantly over the past 2 decades. We matured and learned from our past experiences and setbacks. We completely understand the gravity of our role in filling critical gaps in healthcare services, and we are committed to ensuring sustainability through careful financial stewardship. Our reserves are essential to prevent disruptions to care. Our community depends on us, and we cannot afford to let them down. I want to express my gratitude to the board for embracing the new process we implemented this year for board recommendations. This process was designed to ensure that every voice was heard. Every recommendation was thoroughly vetted by executive staff and our CEO, and most importantly, that we did so equitably. I believe every board member had ample opportunity to provide input, engage with staff, ensuring that this budget is truly reflective of our collective vision. I appreciate the diligence to the new process that the board has adhered to, which will facilitate a smooth budget process tonight without any last-minute surprises. Looking to the future, this budget not only addresses our immediate needs, but also positions Central Health for continued growth and innovation. It is a crucial step in the implementation of our 7-year health equity plan, which is central to our mission of building a more just and equitable healthcare system throughout Travis County. This plan will guide our efforts to eliminate health disparities and improve health outcomes across Travis County. Together, we will build a stronger, healthier community that serves everyone with dignity and respect. Finally, I want to sincerely thank each of you, Jeff, your team, John Morgan, the CEO, all the executives who worked tirelessly days and nights for this day to come, and for your unwavering commitment to health and the well-being of the people we serve. I am deeply honored and humbled to be part of this noble work, knowing that together we are saving lives. Let us continue to support and advocate for the equitable health care that our community so desperately needs. Thank you for allowing me to say these words. Well, tonight, Jeff Kanoto and John Morgan will be presenting our final proposed budget and property tax rate. I hope that we can all have a good and thorough discussion. Nothing new that is going to be presented today that you have not seen or heard of. So I hope that we can have a very fruitful discussion. Please proceed. Thank you.
If I could make one note.
Yes, Chair.
And just a note for everyone, we're presenting this in the Budget and Finance Committee. The vote on the budget will occur as part of the Board of Managers meeting. So this is informational item for us now. The vote will come shortly after we do Executive Committee and later tonight.
Yes, Management Money.
I just wanted to recognize you, Dr. Musaitif, as chair of this committee, the work to keep the guardrails in place that you've worked tirelessly to implement is nothing short of Atlassian. I appreciate your stewardship. You take this so importantly seriously, and that's what we need and what we have needed. And thank you so much.
Thank you. Appreciate your kind words.
Madam Chair,
Yes, Manager Valdez.
I just would like a question answered just for the public. Where can they find this information? On the website with today's information
You can go.
on the budget?
I believe it's on the website under, is it on the homepage or the finance page?
Under finance, I can
Fine.
see the link.
Yep.
If you can,
Yeah, so
just,
it's.
I'm doing it
just-
for the
just so
edification of the public.
Everyone know, it's on our website, www.centralhealth.net, and it will be, there's a tab that says finance, and it will be under the finance tab. Thank you.
Thank you, Jeff.
Thank you. Just one last thing, just members, this presentation this is probably the only opportunity that you'll have to review it before our vote. There will be a shortened version, correct?
No, they can talk about it as part of our vote, but we'd rather do it now.
Yeah.
So,
Thank you.
Yeah, thank you for all the opening comments. Thank you for all the devotion and diligence that the board has taken during this process. It's extremely appreciated from staff. Next slide. One trunk, many branches. The branches strengthen our tree, and you see on this page a mural that memorializes this. That is a mural that's been painted at our Rosewood Zaragoza Multi-Specialty Center that was recently opened. And if you haven't had a chance to see it, please stop by and see both the mural and the clinic. It's really a very extremely nice clinic, and really appreciate all the efforts that went in to opening the clinic and all the board members that have supported that clinic. Next slide. So this is going to be somewhat of a short presentation. We've seen a lot of it in other meetings, and thank you, Manager Kitchen, for mentioning the vote. There will be a vote at the board meeting, the upcoming board meeting, on both the budget and then I'm going to say the tax rates, because it's one rate, but there are a couple different components, so there'll be a couple different votes. Just to give some really high-level financial summaries related to our FY25 budget, the tax rate is proposed at 6.5% above the no new revenue rate. And so in essence, this means that we're requesting, and it's a very prescribed calculation, but the general understanding of it, of the no new revenue rate, would be our property tax revenue would be 6.5% above what it currently is in fiscal year 2024. An increase of $58.2 million in our healthcare delivery budget. That represents a couple different components. A little over $8 million in purchase healthcare services. Significant increase in our direct specialty care health services, and then a little over $20 million in operations and support. Our administrative budget's increasing by $9.9 million, and then other financing sources is increasing by $53.4 million, and that really represents two components. One component is cash financing on our capital projects. And again, this is a 2-year program that we expect to fund about $65 million, so $50 million in 25, 15 in 20, fiscal year 2026. And we think by doing that, based on the current market conditions, that significant interest savings would occur had we debt financed that. And then an additional $11.3 million in our emergency reserve funding based on our prescribed financial policies related to the levels of funding required for that reserve. All in all, our contingency reserve balance is decreasing by $98.3 million as a result of filling in the gap on the expense side that we need to fill in to be structurally balanced in this year's budget. Next slide. Thank you. So, it's been a lengthy and a long process. And again, you know, a lot of appreciation related to all of the board member participation. You see, my takeaway on this calendar is we're almost at the end of the process, so we're at August, but we've undergone a lot of processes prior to getting here. Again, a lot of appreciation for all of the board member input related to the strategic initiatives that we'll work through. And you see a number of meetings where we talked about emerging threats. We went through a process to evaluate the strategic initiatives that were proposed by the board members, and then moved into our financial forecast in May, and then worked through again our strategic initiatives with board members, and went through the proposed budget process, and have had a number of meetings both at Central Health, and then we've had two lengthy work sessions at Travis County related to some of our initiatives, both current initiatives and fiscal year 2025 initiatives. So as it relates to the process, we're here today to take a vote on the tax rate and the budget from the Central Health Board of Managers. And then we have a work session scheduled for September 12th at the Travis County Commissioners Court to propose the budget, and then subsequently that next Tuesday, requesting approval on September 17th. Next slide. So as I mentioned, our tax rate is 6.5% over the no new revenue rate. You see on this slide just a comparison of the average homestead tax bill from fiscal year 24 and our proposed FY25 tax rate. You see that based on the proposed tax rate, our average homestead property tax bill will increase by $66. And then just as a reminder, there are a couple local exemptions that have been approved related to property taxes. There's a homestead exemption that's at 20%, and then 65 and older, and a disability exemption, homestead exemption at $154,000. Next slide. So, as I mentioned, we are scheduled to take a vote at our upcoming board meeting. On this slide is our total tax rate of 10.7969 cents per $100 valuation. That again is at 6.5% over the new revenue rate. You see the two components of that that make up the rate: the maintenance and operations rate, and then the debt service rate that consists of the total rate. Next slide. We've shown this slide a couple times. I think we've gotten to more of a green, yellow, red color scheme as it relates to our reserve strategies. And so, again, we're talking about days of reserves on hand. And you see that we're estimating in fiscal year 2024 our reserve levels. And then you see two components of it that as you move from left to right, you start seeing the slope downwards. The green kind of shaded area, as I mentioned, we're taking a 2-year capital financing budget request. And so you see in the green area where we're slicing that off of our reserves and distinguishing that as one-time funding. The rest of the funding as we go across the page in subsequent years is ongoing expenses as we implement our healthcare equity plan. And you see that, you know, over the years as we implement the plan, and again, with most of those being ongoing costs, that we will spend down our reserves over this period of time through fiscal year 30. Again, the kind of the green area is really the savings that we've accrued related to spending to implement on the healthcare equity plan. You see a yellow bar that kind of cuts across the graph. That's our targeted days of reserves on hand that we try to maintain, that we certainly want to get to and maintain at the end of this period. And then below that, you see the red area, which is anything really below that is something that we just need to have some caution, and we need to be cognizant that we're dipping below that area, and we'll need to manage towards that. Really, the red area is really the reserve levels that we have for any unplanned events or emergencies. The solid red line is the level of emergency reserves that we have. So again, we maintain a reserve level in our emergency reserve fund of 15%, which if you convert that to days is about 54 days. And then the rest of that is our contingency reserve. The kind of checkered red is our contingency reserve. That makes up the difference to get us to 120 to 150 day targeted zone. Next slide. So attachment A is our highest level of budget. This is our budget request. Again, our revenue is mainly consists of property tax of about $346 million. Total unrestricted revenue is right at $390 million, and then you notice the opioid litigation settlement, which is in a separate attachment, but we've included it here as kind of an all funds view. It's $3.8 million. And then on the expense side, our total expenses are $492 million, and you see the different programs. The majority of the expenses are in our healthcare delivery program of $353.4 million, and then you see administrative, the UT affiliation agreement payment, and then again, our other financing uses consist of the $50 million of capital projects funding plus the emergency fund funding related to those financial policy levels, and then our opioid settlement expenses, which are also $3.8 million. And then you see our ending contingency reserve fund of $395.7 million. Next slide. And then just to wrap up the presentation, attachment B, which again we've shown a number of times, but you see some detail related around the healthcare delivery program, our purchase healthcare services broken out by service line, and then our direct practice of medicine around specialty care broken out in a number of additional expanded service lines. The next slide is our operations and support budget related to the support of our clinical services, plus things like the ACA Premium Assistance Program and our Sendero risk-based capital transfer. The total of our operations and support is $134.4 million. And then on the next slide is our administration budget. of $38.5 million, and then our UT affiliation agreement, and again, other financing sources to get us to a structurally balanced budget of $887.8 million. And then the next slide is attachment C, which is the opioid litigation settlement. Again, these are estimated revenues and estimated expenses related around the distribution of those funds. So, again, I'd like to thank everyone, all the board members, for all the input you've given staff, and we really appreciate the partnership that we've had with you, and turn it back over to the chair for any questions.
Thank you so much, Jeff and John. Appreciate it. I've enjoyed working with you over the past this budget. I felt like we've been working for almost a year on this budget. Thank you. They are, but really deeply appreciate it. So I am going to go across the room. I'm going to start first with Dr. Brinson to see if she has any questions. Then I will move along to all members to make sure that everyone has an input if they want to say anything. Dr. Brinson? So Dr. Brinson has no questions. Manager May?
I don't have any questions.
Speak.
I don't have any questions, as the budget is presented. I think that we're on the right track in terms of serving our community based on what, the voters, actually authorized us to do. I will say, and I will be supporting the budget, but I will say that I look forward to figuring out ways on how we can bring in those gaps as we begin to lower our reserves. And I'm also looking forward to, ways on how we might be able to work through some of these agreements that we've got to make sure that we land in the best place possible.
Thank you for that input. We'll take it. Thank you. Manager Jones?
I really, excuse me, have no questions on this. I have sort of an administrative question. Are we going to have this presentation during the board meeting itself? So basically, what we have here is what we're going to be voting on, though.
Correct.
Well, it's not the,
Oh, sorry, go ahead.
it's not the only thing. There's also the resolution itself. So we will go through the resolution, as part of the voting process.
My only other question is that as we enter the 2025 budget, is that we put emphasis on the evaluation of the outcomes of what we're having here. We're spending millions of taxpayer dollars, and what be interested on a frequency of maybe monthly or quarterly or something, that the board hears back on what we have done to address these things in terms of numbers and outcomes, as well as budget utilization to that point. I think that would be very helpful for those of us on the board to get a feel that, yes, what we said and all the work that we went through to get to this point is actually having an effect. So that's the only other comment I would make at this time.
Thank you, Manager Jones. I think we've we've had some metrics that perhaps we can decide on the frequency of when those can be reported back to us. We'll take that into consideration. Thank you. Manager Metwan, do you have any questions related to this budget?
Thank you, no.
Thank you. Dr. Zamora?
No questions.
Thank you. Manager Valdez?
No questions, other than I personally would have liked to have seen, and you have presented it many, many times to us, the 24 budget with the 25 budget so that we could see, I don't have to go back and forth and look on the changes from last year's budget to this year's budget. I always think that that's important for us to look at. I like the idea, and I appreciate my colleagues for wanting to make sure that metrics are developed and approved so that we can see exactly how we have closed the disparities gaps within our poverty populations and our marginalized communities, and to see whether or not the way that we're spending the money, is is it really effective in making sure that the services, that there is actually a positive improvement to one's quality of life. I think that's the only way you can tell whether or not what you're doing works. And I appreciate the fact that we're going to be looking at spending more money on outreach and making sure that we do those deep dives into those populations that have yet to receive services or have yet to participate or enroll in our programs. That's very important to me. I'm concerned about our uninsured population in Travis County remaining so high. And the only way to do that is to make sure that we're reaching them, that we're going out to them, however way we can, whether that be through touch, hand to house, door to door, or through the targeted or marketing programs. Thank you.
Thank you for that.
And I just have to throw in my position on, I wish and I hope that we can get the University of Texas, the medical school, the system itself, to understand the need for us to hold their feet to the fire and make them accountable for the tax dollars that they're receiving from our population, because we believed that they were going to target our indigent, and we just need to make sure that they really do. But we won't know that unless they provide us the data. Thank you.
Thank you. Manager Valdez, Dr. Martin.
Thank you. I just had a question about the transfer to Sendero risk-based. Would that be an ongoing annual fund? I forgot how that was going to work out.
Yeah, typically it's an annual calculation. The plan, the perception of it is that as we wind through, I guess a period where we had a risk adjustment haircut that will exit that period. I think the expectation is that this would be the last year that we would have a risk-based capital funding request that we're aware of in our kind of the plan that's been set out by Sendero. So I think they've shared a plan that, you know, they wanted to come through a stabilization period. And so I think that this is kind of the last tranche of that funding. And the expectation would be, as we move forward, that they would be a little more self-sufficient related to capital.
Thank you very much.
Thank you. Chair Kitchen.
Yes, I don't have any questions. I just want to say, echo what our chair said. Thank you for saying that at the very beginning. And everyone else, appreciate all the effort that has gone into this, and appreciate the effort that each board member made to think about suggestions. And I really felt like that was a collaborative process. And although I'm sure we all will have ways to maybe tweak or, improve it next time around, I think having the opportunity to do that this time was very helpful for the board, and I hope it was helpful for you, Dr. Lee, and for your team. So I also just want to comment that I'm very proud of a whole lot of things in this budget, and I especially want to call out something that's always been very important to me, and that is the medical respite program. It is incredibly forward-thinking, the approach that Central Health is taking to really tackle what is a very difficult issue in our community, particularly for people of color. We know that most of the folks on the street are men, and most of them are African American men. And so I'm really excited about our opportunity to grow this program exponentially and really provide the services that people need. I also would be remiss in not mentioning the jail health and jail health diversion, which is something we've been working on with our partners with the Commissioner's Court for a while. So I'm happy to see that we're continuing those efforts. So I have another comment or two, but I will wait because that's specifically on the resolution. And when we get to that, when we vote on that, I'll comment on that. And just to point out to my colleagues, everybody on the board, the slide that we've been seeing for the last couple of meetings that relate to the staff recommendations regarding the board manager recommended proposals, that is attached to the memo that Jeff Canodal provided to us. So you don't see it in this packet, but it is front and center as part of the resolution that we'll be dealing with later. And I think it, as I said a moment ago, I think it represents the partnership that we were able to achieve with Dr. Lee and you guys and the team. So thank you. That's all I have.
Thank you so much, Chair. Appreciate it. Echo everyone's sentiment. In respect to the process, I'm also a researcher, so I like the evaluation. So at the end of our budget, hopefully once everything passes, we will be sending you all a questionnaire to seek your feedback on what you liked, you didn't like about the process, and how we can enhance it. So to ensure that we can move things smoothly and your voice is heard. And also, Manager Jones, to answer your question, there's multiple votes tonight, so just be prepared. So you're going to be voting on multiple different things, all related to the budget. Okay, there's no motion for this item. Thank you, appreciate you all. Now, you know what? Can we have a clap for this team? Really, thank you all. Really. And Nikki?
The team has been a village, so, again, the easy part is just staying up here and talking about it. But there's a lot of work that goes on behind the scenes. So
Thank you all. Thank
to
you.
everyone that's participating.
Appreciate you. So moving along to item number 3, receive a presentation on the July 2024 financial statements for Central Health. Members, there will be no presentation on this item. The materials are in the backup and staff can be contacted through Brianna if there are any questions. Thank you. You'll like the other one too. Agenda item number 4, receive and discuss the quarterly financial and operational report for community care health centers. This item will not be taken today, but will be brought back for future budget and finance meeting. We have a very heavy agenda, and I wanted us to dedicate our time on this item. So we'll bring it back as soon as we can. Thank you. And now moving along to agenda item number 5, receive and discuss the quarterly financial and operational report for Sendero Health Plans. Ms. Sharon and Ellie will be presenting in open session. After that, we'll go into in a closed meeting. So our presenters are here. Please proceed. My apologies, Karen, your name was not on this agenda. Welcome.
I think it's going to be Ellie as well, so it'll be all 3 of us.
Ellie's online though.
Oh, okay. Do
She's not
you want to
physically here,
pull
but
her up?
She is online. I think, Ellie, are you with us? I saw her earlier.
Hello.
Hi, Ellie. I didn't want to
Hi,
butcher your
everyone.
last name, so I just went with your first one. So my apologies.
That's perfectly fine. Thank you.
Thank you.
We also
Welcome.
have Karen Ader, who's our Chief Strategy Officer, who's going to give us a report on the TPA. So she's with us as well.
Well, thanks for being back again. I believe this is your second visit with us. Thank you so much. So the floor is yours. Please proceed.
All right, thank you very much. Thank you again to the Board of Managers for having us here. We really appreciate the opportunity to try and bring you up to date on the progress within Sendero. And if you don't mind changing the slide for me, be great. Again, this is, Karen's going to talk about the TPA update, and I'm going to give you a little information on kind of an executive update. So if you just move forward again to the next slide. So I wanted to give you a little bit of a sense on how we're adding coverage to the community through the premium assistance programs that we have in place. So we work with HAMS and SIMS, and of course, there's obviously with Central Health and there's for premium assistance. And currently, there are more than, there's like 1,309, more than 1,300 members who receive services through this, serving the musicians and their families in this marketplace. We also work with the MAP Basic program, and in that we have 652 members that participate in that program. And a lot of those people benefit from the federal dollars that come into that. So it's a double funding to make that happen for those 652. And in addition, of course, we have the Premium Assistance Program, and we're looking at 736 members who are currently enrolled in the CHAP expansion program. That's the program that you're kind of very familiar with. So I just kind of wanted to give you some information on that and kind of give you a heads up on how successful is that. If you go to the next slide. I wanted to talk to you about the value of owning an HMO to a hospital district. One of the things that we have been able to do since 2019 is we have done 17 transplants for the members in our community. And, as you well know, transplants are not inexpensive procedures, and we've helped a whole lot of members with that. We've done liver, kidney, and we've done a stem cell or a bone marrow transplants. We've also participated in the CAR T cell therapy. I'm assuming most of you are familiar with that, but that's where you take and give a person back, you convert their cells so that their cells attack the cancer. And it's not inexpensive, only applicable to certain cancers. I think we've had 2 cases that we've managed through the CAR T cell therapies. We have currently 12 members that are currently on a transplant waiting list. That means they're signed up, they're waiting for a kidney or a liver or a lung transplant. I don't know, we've done lungs, but I think that it's not one that we certainly would consider it. There also, in addition, we have 55 members that we put on our registry. We have a transplant registry, and these are people who may qualify, who may need it, who are being considered for a transplant. They either have the clinical conditions that suggest that's appropriate. In the meantime, they're being tested. So you understand, a healthcare facility will not accept a member and put them on the transplant list until they're sure there is adequate funding in place to take care of it. So these people are being confirmed to see whether we will move them from our registry over to the waiting list for these different vendors. So it's really a wonderful program that we could put together, and we do it, of course, obviously in collaboration with Central Health. You're all doing the funding for the premiums for these members, and then we're making certain that these services take place. We literally had a member recently who had a kidney transplant, and he almost dropped off. He was worried he was scary, he was reluctant to have it scheduled, and at the last minute he was going to drop off, and we kind of talked him into hanging around, and sure enough, in a week or so they called him and they had a kidney for him, and he had the procedure, and he came back to us and said, "Thank you so much. You've given me a whole new lease on life." So we see cases like this in circumstances where we really are helping these people to make that work out for them. And I think it's important to understand that this population, and I know I'm preaching to the choir about this, but you have a really challenging population. I've looked at healthcare populations in all kinds of realms, and these people have been disadvantaged, a lot of them, by not having access to health care. It's not been available. They didn't get prenatal care. They didn't get immunizations readily. They weren't followed with primary care through their careers and lives. And they end up in their 40s and 50s and 60s, and they have a lot of complex comorbidities and illnesses that you wouldn't anticipate that they should have. If somebody that had better health care might not be in it. So they're on dialysis. They have a chronic, COPD. They've got some of them are homeless. It's a really difficult population, and they're not accustomed to using the healthcare system. Their resources to the healthcare system is an emergency room. And so, educating them and helping them is, I think, a mission we certainly have. I know Central Health has that mission. And how do we help this population get better? Because they really are in a challenging role in their life. So I just kind of wanted to share those experiences and those circumstances about what we're trying to do in collaboration with Dr. Lee and his whole team with Central Health, and we think we're making really good progress. So the next slide, I think, is on the TPA, and I'm going to turn that over to Karen and let Karen, who's our Chief Strategy Officer, who is overseeing this entire project, and let her give you an update on where we are with the TPA implementation.
This has been a complex project. We are close to going live. The claim system preparation is in its final stages. We've added VBA as our claim system, doing the final configuration and correcting some of the curative configuration that was brought in. Contact Score we've added for our Medicare repricing and editing by bringing them in. It helps us automate and be more efficient and save on cost and reduce staffing needs, which helps also on cost. We've also included an OCR claim scanning system. This will allow us to take our paper claims. We're getting about 20,000 paper claims a day, and I don't think we're on the right slide. I think we might need to go to,
There you go.
no, it's not. That'll be the next one I'll go to. I'll touch on this one real quickly. 20,000 paper claims is quite a bit to bring in, so we're bringing an automated system that we can automate those, and we're going to work with both Central Health and Sendero's provider teams to try to reduce that cost, because that will help our efficiencies and the cost of that. We have started hiring the claims team. We have a claims manager on board, 4 claims adjudicators, a claims auditor, a claims coordinator, and then our system support specialist, and then an appeals specialist. We hired the appeals specialist from within Sendero. The rest came from the industry, have very long experience, understand how a claim system should work, so it'll run efficiently. Day one, we won't have to do a lot of training there. In September, we're adding a director of claims administration and configuration. Sharon was able to recruit someone with extremely strong knowledge of our claim system, VBA, and also has worked with our current vendor and knows Sendero and Central Health's plans very well. So she's going to bring a lot of knowledge in, and she's excited about coming over. We will most likely add one more claims adjudicator towards the end of the year. We're going to gauge what our current adjudicators can manage. If it turns out they can manage all of it, we will not hire that person. We'll keep the costs low. If we need one more person, we may add one more when we bring in all of the Sendero claims.
While you're speaking, let me just add one other thing about Central Health, that we have finalized our arrangements with Central Health and Sendero. We inked an agreement, so we are in set to move forward with serving Central Health in the capacity as their TPA for the MAP patients. Excuse me, Karen, go ahead.
For Central Health, we are set to go live on October 1st. We are going to start accepting all of the claims, the provider, and the benefit information on the 16th. The 15th will be the last day that Curative accepts any information. We will ask them to rent out their stock of claims and any provider configuration that they're doing during the next week after that. We'll be running those claims that we receive on the 16th through a test, so that first week of October 1st, we can process all those payments out to the providers. We'll also be doing a transition that last week of September of bringing all the data from Curative over to our new claim system. It will update all of the history and bring that in. So we'll have all of that to pull in. We're having ongoing meetings with all of the Central Health teams to make sure it's a smooth transition, enhance any programs that they want to, and answer any questions and give them assistance on truly understanding the plan. When you work with an outside third-party administrator, you don't have as much control, and this gives them a little bit more control by bringing it internally to create programs that they haven't had the access in the past. Our provider call center will start taking calls on October 1st. Curative will go all the way through September, and their provider portal will transition actually over on October 1st as well. And Curative will continue through the end of September. So that's the schedule for Central Health. For Sendero on the next slide. We were set to go live for Sendero Health when we did this presentation sometime between November 25th and the 9th. We have decided to move that scale of time up to November 18th. The week between November 25th and 9th is the Thanksgiving holiday week. And when you're working with VBA and some of the other vendors, they're going to be very small staff during that time. So we decided to bring it in a little bit earlier so we can scale up and handle it. We'll be coordinating with Curative on that transition during the first 2 weeks of November to bring all of it in-house. We're also continuing to work with the finance, the data analytics, the clinical, the providers, the claims and enrollment teams at Sendero to go through the transition, train them on any changes, and work with system enhancements as well. The Providers Call Center will take over on the November 18th, and the member portal we're actually bringing in earlier so we can add additional services to our members through that portal. Earlier, we're hoping sometime late September, early October will be the goal on that. And then the provider portal will transition on November 18th as well. So that's where we're at on the status of the TPA transition at this point.
And that is really, that kind of concludes our presentation.
Thank
Unless
you.
someone has a question for us or has anything that they would like to.
I don't see any questions.
I have one.
Oh,
Is,
go ahead, Doctor.
thank you for your presentation. Is our relation with Curative a simply brief, or will be part of your system?
Is it brief?
I mean, is it just going to be as a transition phase, or?
It'll be over once we transition.
Gotcha. Okay, thank you.
There's no run out that they're paying, but we're taking the whole thing over internally.
Okay,
And there'll be no run out
thank you.
that they will monitor. That's what your, that's
I'm
your
not
question.
on camera.
Thank you. Is that the conclusion?
I had one sort of more esoteric question in regards to transplants. When, these are extremely complex patients with difficult social situations, if you're transplanting someone who's homeless or economically really challenged, is there a coordination process going on to get these people housed, to get transplanted? Because to just transplant and send them back to the street with 35 pills to take every day, is that a process that's being coordinated?
It's part of the whole thing. In fact, another recent story, we had a patient who was not a transplant patient, but repeatedly being readmitted, every 30-day readmits multiple times in the hospital since January, and he was homeless. And the last admission occurred in May, and our community health worker reached out to him and managed to get him in a group home. And then she physically went and met with him at his home. And he was, previously he was a dialysis, end-stage renal disease patient. He wasn't getting his dialysis consistently, he wasn't going to his appointments, he wasn't getting his medications. And she got him set up in the home, pharmacy nearby, made certain he understood how to connect with the transportation system. And now he's been going consistently. He has not been in the hospital since. And, this is what the outreach with our community health workers do. And certainly with the transplant, those people in case management absolutely have to be in case management. So, yeah, I agree with you. We can't just, Dr. Bart, we just can't put them back on the street and wish them well.
Okay, thank you so much.
Thank you, Dr. Martin. Chair Kitchen?
Just a quick question, not for today, but just to ask you to provide us some information. I'd be curious about the scope of the numbers of homeless individuals that you end up serving, and I'd like to see some, results kind of data, because I'm certain that there are challenges getting them connected to housing. So I'd just like to understand better with some data about what we've been able to accomplish with them.
Right, we don't always know because they have to have an address when they sign up.
Yeah, I know.
So we only learn that they're homeless in the process of communicating with them and reaching out to them and trying to make contact. But it's very good question. Let's maybe see if we can't give us something for you.
Okay.
Manager Kitchen, we'd love to that's
Thank
good information, good help.
Thank you. Dr. Lee? Oh, Mr. Manager Jones, do you have?
No, I don't have. Sort of a follow-up to Chair Kitchen's question is on data. One is, I am still considering hearing in the African American community, they are not familiar with Sendero. And so I guess maybe at a future meeting, if you could provide us with some data, demographic data, would be very helpful. And you could do it maybe a zip code or geographic, would be helpful. And then the second question relates to what you just said with regards to outcomes. So if we're, instance, Manager Martin talked about the transplant individual. If we are transplanting or we're working to get those things done or other services and they're homeless, how do we measure the success? Is it a process measure or is it an outcome measure? How do we go about doing that? And I'm not expecting you to answer it right now, but that is a question I guess I raise. I would like to be interested in how we do that.
Okay, that's a good question. I mean, I think that's worth trying to come back and give you more specific information. I'd have to do digging into it. Certainly, the 19 that we've had, the 17, I'm sorry, that we have that are, we could go back and give more specifics on the outcome of those particular individuals in the transplant and see. I don't know how many of those were homeless. I mean, that's, none of them may have been homeless at all. But we do see homeless members in the process. So let's see if we can't give you some information both on the homeless and other.
You could raise your volume. Yeah. She's very soft-spoken.
Pointed more towards me. Thank you. Okay.
Okay. Thank you, Manager Jones. Manager Valdez and then Dr. Lee.
I'm sorry, thank you for your presentation.
Your speaker.
Thank you for your presentation. One of the things that I have advocated for, and they at least did it, was they instilled dealing with amputations also. You're talking about transplants, I talk about amputations also. Because one of the things that we found, and having had my late husband having gone through that, is that the hospitals don't provide counseling. Nobody talks to the patient or to the families about what that amputation is going to mean. So if you're going into tests and it's decided right then and there that an amputation is going to occur, like you're going to lose your leg, no one's prepared for that. You come out, you're sent to the hospital room to recover, and there's no one talking to you. So when the patient wakes up, like Orlando did, and he's screaming, "What the heck did they do to me?" And I'm asking, is there going to be psychiatric support? Is there going to be counseling? What's going to happen? Who's going to talk to him? It doesn't exist. That was Seton. That was Ascension Seton that treats its patients like that. And so I want to make sure that Sendero is making sure that if you're going to have a transplant patient, that the family and the patient themselves understand full well what that means every step of the way. The same thing with your amputations. If they understand and are guided to implement strategies for the family to deal with their patient, their member that has lost a limb, and what that means. So I want to make sure that that's included in and part of the transition of care and the service that they're going to be eligible for under Sendero's plan.
Well, certainly, as someone, my own husband had a bone marrow transplant at the Mayo Clinic, and I lived for 6 weeks in February in Minnesota. But but typically the transplant facilities themselves are very focused on that, and we purchase all those services that come along with it. But your question about the amputees is something that makes me want to go investigate more of that. I don't know. I know sometimes we inherit patients that are amputees, but if that's part of our care, then I would love to know more about it. And I think that's a really great suggestion that we've
Right, because that's, especially as it impacts those that don't have a place to go to upon a discharge from the hospital.
So the hospice,
or even at home, have anybody that can help them with that.
So the hospice program that Dr. Lee has spoken of some I mean, strikes me as, if that's the kind of facility that someone, I mean, you can put them in a rehab or or a skilled nursing facility or a rehab or send them with home health, but something that would directly focus on that would really be of value. I think that's an important point. So thank you for bringing that up.
If they're in a SNF, they're not gonna get that.
That's right, yeah.
So-
You really need a,
So they're in a
focused
vacuum.
program. Yeah.
Thank you.
Thank you so much. Dr. Lee?
Thank you, Chairman Saif. Just wanted to compliment and thank the entire team, Sharon, Karen, Ellie, and the whole team. At the start of the TPA process, you said what you were going to do, and then you did what you said you were going to do on time, on target, on budget, when there were many, many, many moving pieces, and it just builds tremendous confidence in me, and I know in my team, to know that we have this caliber partner. Dotting all the I's and crossing all the T's, and putting us on such a firm foundation for the future. I also really appreciate, Sharon, your lifting up specific individual stories. I know there are 700 plus individuals, all of whom actually have very complex histories, complex medical conditions. These are our most vulnerable, most complex patients who we've been able to move over. You've mentioned it before, but I'll mention again how interesting and valuable I find it that we fund roughly $10 million of premium dollars for these 739 individuals, but the total cost of care is approximately $50 million. And because of the careful management of the risk profile of these patients and our younger, healthier artists and musicians and others, we were able to actually balance out that $40 million through the Affordable Care Act CMS risk adjustment transfer, which is not an easy feat to do. It's a bit like doing cartwheels on a balance beam, and I have enormous confidence in that as well. And the fact that our patients who probably would never have expected to have access to CAR T therapy and liver, kidney transplants are getting that care. I agree with my colleagues' comments that we should make sure that we know the outcomes and follow that through, and we will. It's a great point, and the demographics are very important. I agree with that comment, Manager Jones. Thank you for that. But I do think it's extraordinary that we're doing that today, and I'm excited to see what comes in the future. I think there is the strong foundation to build to an even stronger Sendero, and some of the most vibrant health systems have a health plan that is a key strategic asset and partner that allows us to participate in creative ways that we cannot do without you. And so just wanted to thank and congratulate you for the work this year. It's been really an honor to see that. So thank you.
Thank you, Dr. Lee, and definitely echo everything that he said. Thank you. You all delivered. Thank you.
Madam Chair?
Now, we're running out of, is it quick?
No, I was gonna make the motion.
Oh, we don't have a motion yet.
Oh.
No motion. We're gonna go to closed session.
Next item. Okay.
So, managers, I'm gonna take item 6. Discuss and take appropriate action to modify surplus debentures between Sendero and Central Health. At this time, I announce that the committee is convening in closed session to discuss agenda item 5 under Texas Government Code 551.085, Governing Board of Certain Providers of Healthcare Services, and agenda item 6 under Texas Government Code 551.085, Governing Board of Certain Providers of Healthcare Services under Texas Government Code 551.071, consultation with attorney. I just want to remind everyone this is a closed session, and whatever happens in closed session remains in closed session. perfect, thank you. Let me know when you're ready. We're ready? Okay, good evening. It's August 21st, 2024, and it is 5:39 p.m., and we are out of closed session. There is no no motion on agenda item number 5. Agenda item 6, I want to recognize Manager Valdez for a motion.
I move that the committee recommend that the board
Oh, go ahead, sorry.
amend the Sendero Surplus Debenture 1 repayment triggers as recommended by staff and authorize the president and CEO to negotiate and execute agreements to document those amendments.
Thank you. Do I have a second? Manager Motwani seconds. Any discussions? No. I also want to recognize Jeff before we take our vote.
Yes, thank you for the support. This is an item just to amend the surplus debentures as we discussed in closed session. Thank you for your support.
Thank you. Appreciate it. So, all in favor?
Aye.
Any, so Manager Martin? Oh, okay, sorry. So the motion passes unanimously. Yes, and we have Dr. Benson. Thank you all, appreciate it. At this time, moving on to agenda number 7, confirm the next Budget and Finance Committee meeting date, time, and location. Managers, our next Central Health Budget and Finance Committee is tentatively scheduled for Wednesday, September 25th, 2024 at 4 p.m. at the Central Health Headquarters, 1111 East Cesar Chavez, Austin, Texas 78702. At this time, I am ready to accept a motion for adjournment. Manager Valdez moves, Manager Jones second. All in favor?
Aye.
We're adjourned.
Because it's after 5:30, I'm going to go straight to our Board of Managers meeting so we can get to our public communication, which we schedule for 5:30. So, good evening. Today is August 21st, 2024, and it is 5:41. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. The first item of business is public communication. Yesenia, are there any commenters for the Board of Managers meeting?
There are no commentators. Chair Kitchen.
Okay. We'll just go ahead and proceed to the consent agenda. Do I have a motion related to the consent agenda? Item C1, C2, and C3. Manager Valadez?
I move that the board approve consent agenda items C1 through C3.
Second. Manager Musaitiv? All in favor?
Aye.
Including Manager Brinson? All right, we'll now proceed to the regular agenda. The first item is to discuss and take appropriate action on the Central Health Fiscal Year 2025 Budget Resolution. Jeff Canota will be presenting. This first item, managers, is the budget resolution. So we'll do that first, and then we'll move to the votes related to the budget.
Thank you, Chair. Jeff Knoble, CFO. We're going to walk through a couple of items. The first, as Manager Kitchen, Chair Kitchen just mentioned, is to walk through the budget resolution, which was included in our packet that we sent out. And then secondly, we'll have the votes we discussed related to the budget and the tax rate. But what I would say before we start any of this, if it's okay with you, I'd like to turn it over to Dr. Lee to talk a little bit about why we do what we do and some of the experiences that we've had related to our system of care.
Okay, Dr. Lee?
Thank you, Chair Kitchen. Thank you, Jeff. I think Manager Musaitif and Chair Kitchen actually expressed these sentiments beautifully in the previous meeting. But I want to begin by just expressing my deep gratitude to this Board of Managers for accepting me to the team and getting me oriented and up to speed working with us as we stood up a new process that we knew wouldn't necessarily go all according to plan, but then actively managing to that plan together with us. And I think landing in a place where, as was eloquently expressed, I think we were able to move more in the direction of hearing all voices and really incorporating those insights into the budget. And so I just wanted to really thank and acknowledge the maturity and elevation of this board in that process. I want to also make sure to acknowledge and thank our county commissioners who engaged with us in multiple formal work sessions and multiple iterative feedback sessions to help ensure that we were lifting up some of the key priorities that are joint priorities, including, as Chair Kitchen mentioned, making sure that our unhoused neighbors have a kinder and more effective pathway to heal, and then hopefully beyond healing, actually get back on their feet and move out of a cycling pathway of recurrent homelessness, and also working with our colleagues, Sheriff Hernandez and colleagues in the jail, to make sure that we are improving transitions of care, improving eligibility for MAP, substance use care, and more. That has been a real privilege to see that coming together. I would also be remiss not to profusely thank our staff. As Jeff continues to remind us, this takes a village. I'm not sure that I have a precise count, but easily thousands of hours of diligent efforts, I think, to prepare the business cases, vet them in the round through progressive layers of refinement until they reach this body here, and then move forward over the course of the year. So that was really a privilege to see that our team could learn, adjust, and implement a process like that over the course of this year, building the plane, if you will, while we were flying it. And I want to actually lift up an experience I had in the last couple weeks. We've just instituted a 90-day celebration of new team members. This is a wonderful practice that we adopted from our community care colleagues. Jason Fournier has been doing this for a long time, and we heard from many of our team members how much that was a really meaningful moment. So we did that for the first time a couple weeks ago, and it just as it turns out, a number of our team members who were at that 90th celebration actually work at Rosa Zaragoza. And so we were there, many of us around the table at the grand opening, but I wanted to share just a window, the early impressions from our staff, that for them and for the patients in particular who came to Rosa Zaragoza, there was one of those wonder experiences. People walked in, maybe people had been in that building before, and it looks very different than it did. Remarked on the light and the dignity and the feeling of safety that they had seeing that this was the environment of care. And then in particular, some of the patients who have come in are receiving palliative care. Well, that doesn't necessarily mean they're at the end of life. It does mean they have serious illness and they may be approaching their death. And to see the rooms that are carefully balanced between a place that is warm and safe and comforting, it still provides the opportunity for the care environment and the privacy. That was a particular point that my team members lifted up, and I'm really proud to have that physical symbol of what we can do together, the beacon of hope that I think it represents, and all that's to come as we bring all those elements together and really do the work of increasing access in the areas where our patients need that access, reducing wait times, improving the quality of care, and ultimately getting underneath the reasons why many in our community are at risk of dying 10 to 20 years earlier than their natural time. And in so doing, also return a great deal of value to our community. I'm aware that there's an emerging national conversation around the affordability of healthcare. It is an economic issue. I think that is right. It is an economic issue in Travis County as well. I believe I've mentioned in this audience before, but I'll lift it up again. We have a very interesting set of data that were produced last year with the sponsorship of the Episcopal Health Foundation, the St. David's Foundation, and others, the economic impact of health disparities in Texas, that estimates county by county the excess expenses for medical costs, the lost economic productivity, and the cost of someone dying before their time at a rate of about $50,000 per early life year lost, which is an accepted health economics benchmark, maybe the low end of that estimate. And we know that here in Travis County alone, that total figure is $1.1 billion per year, $1.1 billion per year. And that, I believe, is an underestimate because that methodology only looks at the individual. It does not look at their family, their community, the public safety, and so on, the echoes of that. I think that is the low-end estimate. And we know that if we had to proactively pass a budget to spend that money to get the results that we have today, we would never do it. And yet that is the current state, the status quo. And I believe it is our privilege here as part of government, as part of the social contract with our public, to see that public good as our bottom line, to recognize that some of the gaps between the islands of care that we've spoken about here, some of those gaps will not be closed by the private sector. Some will not be closed by nonprofit actors who need to make their ends meet this year on their balance sheet. There's a role for us to create a large table with many seats, a safe harbor with many docks, work with many partners, but to plan out year by year and multiple years out to begin to knit together the pathway between those islands of care so that our patients can safely cross. And it is with a great honor that we present this budget to this body this year as another beginning toward that journey. So thank you so much for the privilege of being with this team and presenting this budget to the board for your consideration.
Thank you, Dr. Lee. Do you want to, Jeff, would you like to do this as present and then we vote for each item, because there's 3 different items?
If you don't mind, yes, that works the best.
Okay, let's start with the first one then, which is the
Right,
resolution.
so we have three items. The first is item number 1, the budget resolution. And so this is a narrative related to our budget and our focus on strategic initiatives. We provided this draft in the agenda packet, and I will turn it back over to the chair for any questions or comments related to it.
Yes, well, my first comment is that there's a memo that goes along with this resolution, and I want to thank you, Jeff, for sending that out. I read this memo as by way of explanation, and it calls out the highlights for what is in the budget, and it also calls out the staff recommendations on the Board of Managers' recommended proposals, and the slide that we've been reviewing for the last couple of meetings are attached to that memo. So the way I read this resolution, when we vote on this resolution, we are also including as part of that the memo and the attachment to it, which is the recommendations, because those items they're built into the budget. So so that's my understanding. Is that your intent?
Yeah, yes,
Okay.
thank you for clarifying. I was remiss in
That's okay. I just wanted
omitting
to-
that. So yes, it is the schedules, and it's also the board initiatives that we
Okay.
went through, the strategic initiatives.
Okay.
So thank you for pointing that out.
Okay, I will go around the room and see if anybody has any questions on the resolution. We'll start with Manager May. Do you have any questions?
No, but I do want to commend, Madam Chair, your leadership in this, because I think that you've been instrumental in ensuring that we bridge the service needs with the different county governments and city council. Oh, sorry. Again, I want to commend you for your leadership in the resolution, because I do believe that you have been instrumental in ensuring that the different government entities that have been speaking to us and have been talking to us and through the years about some of the needs that they were seeing or have been seeing, that we've been able, through your leadership, we've been able to address them now in this forthcoming budget that we're getting ready to approve. That being said, it's not a perfect budget. We've got some issues still with it, but with that, I think we're off to an excellent start.
Thank you. Manager Jones, any comments or questions on the resolution and the accompanying memo?
No, I'd like to concur with my colleague, Manager May, with regards to your leadership and as one who's been on this for about 5-6 years, this is one of the few times, probably the first time, where I felt that, at least as a board member, I had the opportunity to have a lot of input in terms of it. So thank you, and thanks staff for allowing us the opportunity to do that. Having said that, I'm inclined to be supportive of most of what we have here. There are others, and I'll talk a little later about those, but for the most part, I'm glad to see the inculcation into the budget of the things that we need to talk about and focus in on the population that we service, and not forget them in that. And I think this is reflective of that. So that's all I'll say at this point. Thank you.
Thank you, Manager Maflahe.
Echo. And, when it comes to these staff recommendations, this is a very, it was novel, but not groundbreaking, but very much appreciated. It's a difficult thing to embark on, and for us to arrive where we've arrived is special. Also, as far as this memo is concerned, this is a little self-centered. However, one of the recommendations, that I submitted, which I'm grateful for its inclusion, as well as Jeff's extensive time talking to me about it. I just wanted to make sure, if I could ask Jeff directly, the one related to conducting outreach to perhaps hospitality industry employees for enrollment coverage. We had discussed it wasn't necessarily just a blanket outreach, but this was to comprise feasibility study and analysis before outreach, and I wanted to see, is it important for us to enumerate that here or amend that language in this one line, or is this demonstrative enough as it is, as far in your opinion?
In my opinion, it's demonstrative enough to I think demonstrate what at least I think we discuss. So
great.
Fine with that.
Thank you, Chair.
Okay. Manager Messiah?
Thank you. As I stated earlier, I'm really happy with this budget. It is reflective of services and who we are as a community, and to addressing the needs of those who need it most. So I commend Jeff and on his work, and it's wow, I can't believe we're here today, but thank you. I'm just proud of all this work. Appreciate you.
Manager Brinson, did you have any questions about the resolution or comments?
No questions.
Okay. Manager Zamora, did you? Manager Valadez?
I appreciate the time and the thought that I appreciate the time and the thought that staff, Jeff, you and John put together the resolution, the time you spent on it, and taking into our concerns and our comments over the last several meetings and several months. I really do appreciate it. There are things that I cannot support philosophically, and I think that they're foundational issues that Central Health, but we can't address that. We can't deal with that. They're contractual issues that were language that was excluded and not put into what would have been a better functioning agreement between us and the University of Texas, or us and Seton, to make sure that our populations were going to be receiving the care that they absolutely needed. I think that caps on the MAP patients was illegal, should never have been done. And I do believe that to not have accountability language in our contracts with UT also should not have been incorporated. But the resolution should allow us the opportunity to vote up or vote down on those components. I do want to say that we have a lot of people that have a lot of needs that we still need to get to. And I appreciate that this is the first time in a long time that I believe Central Health, and I think that Central Health is taking a step to move in that right direction to address those needs. But we do need to take into consideration the need for metrics, for outcomes, to be what fuels our strategies, and for those populations to be at the table telling us what it is that they need, as opposed to what we think that they need, and focusing the conversation on what we want to hear from them as opposed to what we want them, what we need to hear from them, and incorporate into our strategies. So thank you, and let's move on to the vote.
Manager Martin, do you have any comments or questions on the resolution and the memo attached?
Yeah, I just have a comment, and I'd like to say I'm very proud of this budget. I think it's reflects our goals and our directions, and I do look forward to our continued budding and growing relationship with the University of Texas. Thank you.
Okay, managers, the first vote is on item number 1, which is the resolution and the attached memo, which includes the staff recommendation regarding the board manager recommended proposals. So I need a motion, sorry. No, motion on item number 1.
I move that the board adopt the budget resolution as provided by staff.
Second? Second from Manager May.
Question.
Yes.
Okay, so if we vote for this budget resolution before we have voted for any of the resolutions, then that means we vote for the budget resolution in toto. Because it doesn't seem that that's the case.
So if I'm hearing you correctly, you would like to, there's three votes.
Right.
There's the resolution and accompanying memo, there's the actual budget, and then there's the tax rate.
Right.
Are you asking to vote on the budget first and then the resolution?
Yes.
I don't think it matters what order we take it in. I'm happy to do that.
And the only reason I do that is to
I understand.
accommodate. Thank you.
Understand.
I appreciate that.
So what we'll do, I'm going to put that motion on the table, and we'll come right back to it. So we're going to move on to item number 2. Jeff, do you have anything you need to say about item number 2? Item number 2 is the vote on the actual budget.
Right, all I would say is we did a detailed presentation at our Budget Finance Committee meeting, and turn it back over for a vote.
Okay. All right, so managers, before we begin voting, I'll just note that this is the vote on the actual budget. There are a number of different motions because, this is something we've done over the years, which have allowed us to break out our votes on the budget. Mr. David Duncan advised folks for us that if there's an area of conflict or duality, or if you just want to vote separately, you can do that. So we have broken out the vote on the budget into three different motions. A first motion, a second motion, and then a final motion. That is that, and then this is all.
Four.
There's 4.
I'm not aware of anybody needing to vote on the third one separately, do we?
Doctors and more.
Pardon?
Doctors and more.
Okay, all right, so there's 4. And so we'll take each of those separately. There's the first 3 that break it out, and then the last one is on the whole budget. So, first one, and I'm just gonna read these for clarity purposes. The first, and I'm gonna make the motion on the first one. I move that the board approve the budget items in the Central Health fiscal year 2025 budget that pertain to the University of Texas at Austin. So this is a motion specifically related to the budget items that pertain to the University of Texas at Austin. Do I have a second? Manager Musaitiv. So vote for this if you're voting for the budget items related to the University of Texas at Austin. All in favor?
Aye.
Aye. Those opposed? Okay, did y'all capture? Pardon? Okay, well, I'll get to abstain. Any abstentions? Okay. All right, I'll move on. Did you capture that, David? Okay, I'll move on to the second one. I move that the board approve the budget items in the Central Health fiscal year 2025 budget that pertain to the University of Texas system. So same kind of thing. This is the University of Texas system. Those, may I have a second? Manager Musaitiv? Those in favor, please vote aye.
Aye.
Those opposed? Okay, and abstentions. Okay. David, you can show me voting aye on both of these first two. Okay. Now I'll get to number 3. I move that item 3 relates to, well, I'll just read it. And I move that the board approve the budget items in the Central Health fiscal year 2025 budget that pertain to purchased health services, specialty care, behavioral health, and integral care and project access. This is a motion that we've done many times for folks that feel like they have a conflict or duality of interest. So do I make that motion? Do I have a second, Manager Musaitiv? All in favor?
Aye.
Aye. Any opposed? Any abstentions? One abstention. Okay.
I would like to make a clarifying point.
Okay.
Project access essentially is no longer existent.
Okay, thank you. Can we strike project access?
You can strike project access, doesn't even exist.
Sorry about that. Yeah, okay. All right, I'll now move on to the last motion. I move that the board approve the Central Health fiscal year 2025 budget for all items other than the items relating to the University of Texas at Austin, the University of Texas system, purchased health services, specialty care, behavioral health, and integral care. All right. Second from Manager Musaitiv?
Manager Matlani, actually.
Okay, you want to second it, Manager Matlani?
Happy to second it.
Okay. All in favor? Aye. Any opposed? Any abstentions? Okay. All right, so now I'm going to go back to item number 1, which is the resolution, and I'm going to take up the motion and the second that we had on the item number 1, which is the resolution and the accompanying memo and the staff recommendations regarding board manager recommended proposals. I think we already took it, motion and second. All in favor?
Did we have a second?
Yeah.
Oh,
Yeah.
oh, okay, thank you.
All in favor?
Aye.
Any opposed? Any abstentions? No. Okay. All right, now we're going to go on to item number 3, which is discuss and to take appropriate action on Central Health's proposed fiscal year tax rates. Jeff, did you have any comments you wanted to make before we take the vote on this one?
Yeah, real quickly. So again, there are 2 components of the rate. There's the M&O rate, which has been set at 6.5% over the what's called the no new revenue rate. There's the debt service rate that you will take a separate vote on. And then lastly, the total rate. The other thing that I would mention just real quickly is that we're following state prescribed language on the motion.
Yeah.
And so it's a little apples and oranges at times. It's a little wonky, but I think David has prescribed the language very explicitly to comply with the law.
Okay.
Thank you.
All right, before I move on to taking the vote on this, I've neglected to say that on our previous vote, we're going to need everyone to sign the budget resolution. So that was provided in your backup materials, and Brianna will be contacting each of you to obtain your signature. So just want to give everyone a heads up on that. And that's on the budget resolution. Yes.
Can we just do that immediately following our meeting?
Yeah,
upon
I would think
adjournment?
so.
Thank you.
I think we could do that. Okay. All right, I'm going to now move to item number 3, the vote. As Jeff said, we have, this item is consideration of the revised tax rate, which funds the Central Health fiscal year 2025 budget. This is the tax rate only and does not affect the homestead tax exemptions for residents over the age of 65 and residents who are disabled or veterans. Y'all may recall that we already approved that and sent it forward to the Travis County Commissioners Court, and they have approved what we recommended. So this is on the rate itself, not on those exemptions. So, and as Jeff said, each one of these, there's 3 parts. They each require a roll call vote. And for this roll call vote, Ms. James will call the name of each board member in attendance. Each board member must indicate whether they are voting yay, nay, or abstaining from a vote on the tax rate. Ms. James will confirm your vote before moving on to the next member to ensure we have an accurate vote tally. So the first one is item A, and I'm going to recognize Manager Musaitif for making that motion.
3A, for the maintenance and operations tax rate, I move that the property tax rate be increased by the adoption of a tax rate of 0.103502 dollars, which is effectively a 6.5% increase in the tax rate.
We're ready to proceed. We have a second from Manager Motwani.
Second.
Can I hold, so it's.
Yes.
Can we just state the rate and not, it's not dollars, it's just a rate per $100
Oh, just, okay.
valuation?
Do you, okay, all right. You want to proceed?
Did we have a second? Chris?
Yeah, we have a second from Manager Motwani.
Okay. I'm just gonna go from left to right. So, Manager Guadalupe Zamora? Yes. Manager Guadalupe Zamora votes yes. Manager Cynthia Valadez? Yes. Manager Cynthia Valadez votes yes. Secretary Manuel Martin?
Yes.
Secretary Manuel Martin votes yes. Chair Ann Kitchen?
Yes.
Chair Ann Kitchen votes yes. Treasurer Maram Musaitif?
Yes.
Treasurer Maram Musaitif votes yes. Manager Amit Matwani?
Yes.
Manager Amit Matwani votes yes. Manager Shannon Jones?
Yes.
Manager Shannon Jones votes yes. Manager Elisa May?
Yes.
Manager Elisa May votes yes. And then Vice Chair Cynthia Brinson.
Yes.
Vice Chair Cynthia Brinson votes yes.
Okay, thank you. Now we'll proceed to B. Manager Martin, I'll recognize you for the motion on B.
Thank you. Motion B relates to the debt service tax rate. I move that the property tax be decreased by the adoption of a tax rate of 0.004467, which is effectively a 3 3/10% decrease in the tax rate.
Second.
Second by Manager Valadez.
Okay. Manager Guadalupe Zamora? Yes. Manager Guadalupe Zamora votes yes. Manager Cynthia Valadez?
Yes.
Manager Cynthia Valadez votes yes. Secretary Manuel Martin?
Yes.
Secretary Manuel Martin votes yes. Chair Ann Kitchen?
Yes.
Chair Ann Kitchen votes yes. Treasurer Maram Musaitif?
Yes.
Treasurer Maram Musaitif votes yes. Manager Amit Matwani?
Yes.
Manager Amit Matwani votes yes. Manager Shannon Jones?
Yes.
Manager Shannon Jones votes yes. Manager Elisa May?
Yes.
Manager Elisa May votes yes. And Vice Chair Cynthia Brinson?
Yes.
Vice Chair Cynthia Brinson votes yes.
Thank you. Managers, we'll move on to item number C. I recognize Manager Motwani to make the motion on item number C.
For the total ad valorem tax rate, which is the sum of the maintenance and operations tax rate and debt service tax rate, I move that the property tax rate be increased by the adoption of a tax rate of 0.107969 dollars, which is effectively a 7 2/10% increase in the tax rate.
And we have a second by Manager Musaitif.
Manager Guadalupe Zamora? Yes. Manager Guadalupe Zamora votes yes. Manager Cynthia Valadez? Yes. Manager Cynthia Valadez votes yes. Secretary Manuel Martin?
Yes.
Secretary Manuel Martin votes yes. Chair Ann Kitchen?
Yes.
Chair Ann Kitchen votes yes. Treasurer Maram Musaitif?
Yes.
Treasurer Maram Musaitif votes yes. Manager Amit Mawani.
Yes.
Manager Amit Mawani votes yes. Manager Shannon Jones.
Yes.
Manager Shannon Jones votes yes. Manager Elisa May.
Yes.
Manager Elisa May votes yes. And Vice Chair.
Yes. Yes. Can you hear me? Yes. Did I lose my sound?
We heard you.
We heard you.
Okay, okay.
Okay, thank you. All right, thank you very much. Thank you, Jeff. Thank you, Brianna. And thank you, managers and everyone. Wow. Okay. So. Okay, everyone, as you, we will also be, we'll also need to obtain our signature on the tax resolution related items. And just as a reminder, the tax resolution summarizing these votes will be presented along with the budget to the Travis County Commissioners Court on Tuesday, September 17th. As everyone is aware, the Commissioners Court needs to approve our budget. Okay, we're now going to go into executive session on items 4, 5, and 6. Item 4 is to discuss update on matters related to the performance review contracted by Travis County, including delegations to the President and CEO to execute necessary agreements between Central Health Travis County and Mazars USA. Item number 5 is to receive and discuss a briefing regarding Birch et al. Versus Travis County Healthcare District, DBA Central Health, and Dr. Patrick Lee, cause number D-1-GN-17-005824 in the 345th District Court of Travis County. And item number 6, which is to receive an update from council on the impact of certain state policies on MAP membership. I announce that the board is convening in closed session to discuss agenda items 4, 5, and 6 under Texas Government Code, Section 551.071, consultation with attorney. We are back in open session. The last item on our agenda is item number 7, to confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is scheduled for Wednesday, September 25th at 4 o'clock at the administrative offices here. At this time, I'm ready to accept a motion for adjournment from Manager Valadez, seconded from Manager Martin. All in favor?
Aye.
Aye. Okay, we are now out of the Board of Managers meeting. So, good afternoon. Today is August 21st, and it is 7:30. As a quorum of the committee is in attendance, I'd like to call to order the meeting of the Central Health Executive Committee. The first item on the agenda is to approve the minutes of the Central Health Executive Committee July 24th, 2024 meeting. I'll take a motion from Manager Musaitis, second from Manager Martin. All in favor? Aye. That passes. Item number 2, we're just going to take that in our backup. This is the item about the scheduling of items for future agenda. That's in your backup. I'd invite you, if you have any comments or questions, to reach out to Brianna and let us know. So I'm going to move on to item number 3, confirm the next regular executive committee meeting date, time, and location. Managers, our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, September 25th at 4 p.m. Here at the Central Health Administrative Offices. This time I'm ready to accept a motion for adjournment. Manager Musaitis, second from Manager Martin. All in favor? Aye. Okay. We are closing the executive committee. So managers, we are finished.